Well, to talk now about the link between family planning and global development, I'm absolutely delighted now to be joined by Professor Bill Peterson. Professor Peterson, welcome.
Thank you.
So what are some of the main points that you make in this Lancet series?
Well, what the Lancet series does is it takes the new science and takes the science that we've had for some time and compiles it together, making a compelling case for a strong link between family planning and achievement of the Millennium Development Goals. When we look at meeting the unmet need for contraceptive use, and there are about 222 million women who want to prevent pregnancy but don't have access to a modern method of contraception, meeting that need would markedly reduce maternal deaths by an estimated 29 to 30% additional maternal deaths. Reductions in risk of child mortality, but we see not only achievements in health objectives in the Millennium Development Goals, but also objectives related to more macroeconomic effects, looking at the health of communities, nations, and even the population as a whole and the planet as a whole in terms of environmental sustainability.
So why 2012? Why now?
Well, the Millennium Development Goals at the dawn of the 21st century, there was a commitment to reduce poverty and all the related conditions to which over 1 billion of people are currently subjected. And looking at those goals and how to achieve those goals, family planning was not part of the Millennium Development Goals. But we now have compelling evidence for this strong link. It could lead to a rebirth, a repositioning of family planning.
So, Professor Peterson, what's this all about? Is it a question of money? Is it a question of political will? Is it a question of resources? What do we need to make this work?
What we need to see now, and we're seeing increasing political will and priority, is moving into this space. It's an achievable objective. We need to meet the unmet need for 222 million people. The new Summit on Family Planning in 2 days' time is a commitment to reduce by half to 120 million people to increase availability and access to contraceptives for those women, and we need that.
So from this paper, from this symposium, the conference this week, what do you want the takeaway to be? What do you want people to do?
Well, the takeaway for this series is that we now have compelling evidence for this strong link between family planning and achievement of global goals. Meeting the unmet need for contraception would help us, we won't cross the finish line with that, but it'll help us immensely in getting there.
Well, Professor Peterson, thank you very much indeed for joining us today on Global Health TV.
Thank you.